All right, today we will be going over medical terminology. So I mentioned on Friday that this is super important for you to pay attention just because I will be using these medical terms throughout the year. It's not just going over this chapter. So just try to, pay attention, pick up the terms. I don't expect everyone to have everything memorized, but just again, try your best. And I will try to explain this and break it down as easy as possible. And then if you are having any questions, obviously reach out to me. All right, so medical terms come from Latin or Greek words. That's why a lot of them sound really weird. They're probably words maybe you've never heard before, and that can be due to the fact that they come from another language. But it's super important for you to start recognizing these different word parts, understanding what they mean, because it will help you to simply understand medical terminology. So that means if I'm up here and speaking, I'm not up here, but if I were in a classroom and I'm up in front of you guys speaking, and I'm explaining something, you can kind of figure it out because you understand what these terms mean. All right, so the very first thing I want to talk about are your eponyms. So these are terms used in medicine that are named after either people, places, or things. And so what I have below are just a couple examples. You guys do not need to write all of this stuff down, just maybe a couple of them, but you have eponyms for anatomical parts. So anatomy is just different body parts. Achilles tendon would be an example of this. Adam's apple would be another one. Eustachian tube, Golgi apparatus, all of these words sound really weird, but they're named after people. You also have diseases that are named after people like Lou Gehrig's disease, Alzheimer's disease, Down syndrome. Those are all named after people, typically people that are either the discoverer of it or like Lou Gehrig. He was actually a baseball player way long ago, and he was one of the first people to actually present with his certain types of symptoms. You have your fractures. So Colles fracture, Hill-Sachs fracture. We will go into skeletal issues, and obviously fractures are the fancy medical way of saying a broken bone. But I talk about it more in sports medicine. And then you also have medical treatment. So maybe you've heard of the Heimlich maneuver. That's the procedure that you're supposed to do if you suspect yourself choking or someone else choking, where you're putting your hands on your stomach and pumping it. And then pasteurization, we've already talked about. Just remember, Louis Pasteur was the discoverer or creator, I guess, of pasteurization, where you're heating up something to a certain temperature in order to kill germs, bacteria, things like that. All right, you also have medical abbreviations. So these are shortened words, and they're usually intended for convenience. They're typically just a couple of letters. So you kind of had a couple of them when we were going over the different credentials for the different healthcare careers. But they're also abbreviations for everything, for procedures, diseases, recommendations, treatments, things like that. So there are terms that are used, daily. I use some daily when I'm in my athletic training room. My students that do intern with me know these terms. It just helps a lot when you're actually taking a patient history or even communicating with someone, because one, you can say it more quickly with an abbreviation, and then you're able to write it down more quickly as well. You have what are known as word parts. So this is a part where some students have, a little bit of confusion. This is going to be a little bit of a grammar lesson, English lesson. So just try to pay attention. But it is pretty much impossible to memorize all the medical words. I will be scanning the pages of this chapter and putting them on Classroom, and you will see there are hundreds of word parts. And I will say I know a pretty good handful of them, but I can't say that I know every single one. And that's probably due to the fact that I just don't use it frequently in my job as an athletic trainer, or even as a teacher, but there are lots. And then if you are able to kind of understand what these word parts are, you can kind of figure out what it is that someone's talking about, even if you've maybe never heard of it before. All right, so your word parts, this is where we get into the little English lesson. You have prefixes, suffixes, word roots, and then combining forms. So all of those different things are important when we're talking about the different parts of a word in medical terms. So prefixes. Prefixes in English, and even in medical field, are the part of the word that's at the very beginning of it. And it's in the medical profession, it's usually going to indicate a number, a time, a position, a direction, a color, or a sense of negation. So example of this, if we're talking about bilateral, I don't expect you guys to understand what lateral means, but bi means two, in medical terms. And so you can say to, and then at least you understand part of the word. Kind of similar with that, you have the word abnormal, and I'm sure you've heard of that before. AB or ab means opposite or absence, and then obviously you know what normal means, so it would be the opposite of normal. You have your suffixes, so these always come at the end of the word, and they usually in the medical field indicate a procedure, a condition, a disorder, or a disease. So this word right here is an example, tendinitis. Tendon is pertaining to a tendon in your body, and then itis means inflammation. So with this, if you put it together, it means inflammation of a tendon. So again, that itis part is indicating a condition that is happening in the body at the tendon. You have your word root. So this is like probably one of the most important parts of the term. And that is because it tells you what it is that we're talking about, what body part we're talking about, what region we're talking about. So on Friday during the Kahoot, I think there was a term that was like echocardiographic technician. Cardi is pertaining to the heart. And so if you know that, at least you can kind of figure out, at least you know what body part we're talking about. Enceph is pertaining to the brain. So you probably have never even heard of that before, because some medical terms don't sound like what it is that they're talking about, like enceph and brain. But if you have words like, you have larynx, that's a part in your throat. Laryngo is the word root. So at least that one kind of sounds kind of similar, but not all of them do. So just remember, enceph is pertaining to the brain. So if I said somebody has encephalitis, what does that mean? Itis means inflammation, enceph means brain. Put the two together. Okay, they have inflammation of their brain. All right, you also have what are called combining forms. So these are usually a vowel that you then use to put two of those parts of the word together so that it is connected and it just kind of flows. So I'll show you an example of this, but just know it's a vowel that then connects all of those parts together. So if you have these four parts, then you're able to create a medical word. And then once you're able to know these different parts, you can kind of figure out and interpret what the meaning is. So I was taught that you should always look at the end part of the word, so the suffix, to kind of figure it out, get a general idea of what it is that the person is talking about, me, what I'm talking about, or what a healthcare professional is talking about, and then you can go from there. So like itis, encephalitis, itis is that inflammation. Look at that one. Okay, we're talking about some type of condition that causes inflammation, and then you would go to the next section. Which is where you would then check the word root. So if I said something like somebody has carditis, again, itis means inflammation. Card is pertaining to the heart, because that would be the second thing. And then because itis ends in an I, you do not need to add a combining vowel or combining form. However, if the suffix ended in a consonant, so this is where again, English comes in. Vowels are anything that's A, E, I, O, or U. Consonant would be anything that's not that. So let's say it ends in a G. That's where you would have to add that O before the G to kind of put the two together. It'll make more sense when we continue to practice this, but just keep that in mind. So again, example, cardi is pertaining to the heart. Gram is a type of diagnostic test. Because this G is not a vowel, it's a consonant, you need to add a vowel in the middle. So again, just try to keep that in mind. If you're still confused, I totally get it. If you get it, then great, but we'll keep practicing this. And then if you have a term like epicarditis, again, itis ends in an I or starts with an I. So because of that, that's a vowel. You do not need to add an O right here. So epicarditis, it's not going to be epicardoitis. That would sound weird too. Term like otorhinolaryngology is extremely long. This is honestly not the longest word in the medical dictionary, which is kind of shocking, but oto is anything that is pertaining to the ear. Rhino is anything that's pertaining to your nose. Laryngo is your larynx, so that's your voice box. And then ology means the study of. So how do we put this all together to make a word? And what does that mean? So otorhinolaryngology means the study of the ear, nose, and throat. So you actually have doctors that specialize in this. Neuritis is probably a little bit easier. So if we broke this down, itis again means inflammation of. Ner is pertaining to a nerve. So again, if we're going to put these two together, itis ends in a vowel, so you don't need to add anything in between. So neuritis just means inflammation of a nerve. You have word parts that also indicate color. So anything that is color is usually at the beginning of the term, or it comes before the word root. So cyano means blue. Cyanosis is a condition where if you're lacking oxygen, the skin can actually have like a bluish grayish tint, and that's just because you're lacking blood flow, and then you're not getting oxygen. Erythro is meaning red, so erythroderma. So derma is skin, erythro is red, so this means somebody probably has red skin. Leuco is white. I don't know if you know what cyte is, but cyte is pertaining to a cell, like a blood cell. So if you put the two together, it's a white blood cell. Melano means black. So oma is a tumor or type of cancer. And so basically what melanoma is a type of, cancer tumor that's black in color. Polio means gray. So again, I don't expect you guys to know what this means, but again, you have poliomyelitis. Itis means inflammation. If you know what myelo means, that's actually spinal tissue. And then polio is gray. So basically, it's a gray inflammation of spinal tissue. You also have plenty of words that start with R's. These are ones, though, that we'll talk about a little bit more frequently. So you have rhasia or rage. This means a bursting forth. It's abnormal, excessive blood flow. So an example of this would be a hemorrhage. Hemo is blood. And then if you have this, which means a bursting forth, excessive flow, someone who has a hemorrhage is they're bleeding severely. They have an excessive flow of blood. And so you can have a hemorrhage where they're actually cut and they're bleeding profusely outside of their body. But then you can also have internal hemorrhages, which I would say are probably more severe because you're going to have swelling, especially in areas like the brain. You have raphe, which means suture or stitch. So again, I know you guys don't know what myo means, but myo means muscle. So basically, if you put these together, somebody has a stitch or suture in their muscle. You have rhea, which means flow or discharge. So I'm sure people have had diarrhea at some point in their life, not to get too TMI, but that's just like an excessive flow of obviously poop. But you can also have what's called rhinorrhea. Rhino means nose. So if you put it together, you're having excessive discharge from your nose. So if you've ever had a runny nose, that's rhinorrhea. And then you also have rhexis, which means rupture. So this word pertains to the body part, relatively simple. So ovary. So if somebody has ovariorectus, that means that they have a ruptured ovary. So again, it's important to kind of understand little parts, and then you can kind of figure out what the word means. You also have ectomy. That is just a surgical removal of. You have otomy, which is surgical incision into. And then you have ostomy, which is a surgical opening outside of the body. So appendectomy is probably a more common one. Appen is pertaining to your appendix. Ectomy means removal. So basically, it's your appendix has been removed. Otomy, let's see. Craniotomy. Crani is pertaining to your head or skull. And then otomy is an incision into. So if somebody had a craniotomy, then they're having a surgical incision into their head. Ostomy, again, that's that surgical opening from the inside of the body to the outside. A colostomy is an example of this. Colo is pertaining to your colon. Some people who have severe digestive conditions, such as Crohn's disease, or maybe if they have colon cancer, they will actually have to get parts of their intestine removed. And because of that, they will then have to have a tube that's coming from their intestine, and it's an opening that's created to this little bag that sits outside of their body, and that's actually where they go to the bathroom. So number two. And again, it's kind of not the best thing. It's kind of unpleasant, but the reason why they do it is so that you're not getting all of that stomach acid, all of that bile in the tissue so that it's actually able to heal. And then just last thing, I know you might be confused. Again, we'll just keep practicing this, but it's just important if you do plan on working in healthcare, or especially just for this class, that you understand what the basic parts mean, how to kind of break them apart. And then it can help you with understanding what it is that I'm talking about, what a healthcare worker is talking about, and so forth. So again, just make sure you turn in your notes for today. And yeah, we'll talk more about this tomorrow. Have a good day.